the testing requirements that the U.S. and Canada, the U.K. are putting into place are not meaningful. They aren't going to do much because this is an endemic respiratory virus, and these Omicron variants are spreading in the UK, in Canada, in the US, everywhere you look. You don't have to go to China to get it.
Now, the Chinese government has said the travel restrictions imposed by several countries on people arriving from China are politically motivated, and it's warned that it may retaliate. The Foreign Ministry spokesperson, Mao Ning, criticised the measures in a briefing, saying, "We believe that the entry restrictions adopted by some countries targeting China lack scientific basis, and some excessive practices are even more unacceptable." The US, India and the UK are among the countries that have introduced mandatory testing for arrivals from China after the recent surge in COVID cases after the country eased strict controls. Well, let's talk to Dr. Amesh Adalja, who is a senior scholar at the Johns Hopkins Center for Health Security. Good evening to you, Dr. Adalja.
Good evening. Thanks for having me.
Really good to speak to you. Tell us a bit more about China's response to the restrictions that have been introduced in the US and other countries, including the UK.
I think what they're trying to point out is that these are not really going to be very effective measures at curtailing cases, that they're being put into place for political reasons, much like what happened in the early days of the pandemic when there were Chinese travel bans, for example, in the United States, even though the virus was already spreading in the U.S., or what you saw during the early days of Omicron, where the U.S., for example, initiated the travel ban against many Southern African countries, even though Omicron was going to engulf the United States irrespective of that travel ban. And I think that's what the Chinese are responding to, is that, and this is something that many people in my field also agree with, that the testing requirements that the U.S. and Canada, the U.K. are putting into place are not meaningful. They aren't going to do much because this is an endemic respiratory virus, and these Omicron variants are spreading in the UK, in Canada, in the US, everywhere you look. You don't have to go to China to get it.
There has been a sense, certainly in the UK, that this is a sensible precaution to take, given that there's already a lot of pressure on our health service here, and people felt that the last thing we need is another upsurge in COVID cases, potentially brought in by people coming from China, where, of course, there has been a huge upsurge.
It's true that there is a huge upsurge in China, but I don't think that these cases from China are meaningfully going to change the trajectory of the pandemic in the UK or the US or any of those places where there is a heavily vaccinated population, a population that also has hybrid immunity, where there's access to antivirals like Paxlovid. I really just don't think that this is a major issue for countries in the Western world. I think this is an issue that China has to deal with, and it's a horrific situation that they put themselves in. But I don't think it will have any major impact on the way other countries deal with COVID-19, just because there's such a different elements at play in the U.S. and the U.K. and Canada in terms of hospital capacity, in terms of immunity in the population and access to antivirals.
I mean, China, until recently, of course, had this policy of very strict lockdowns, which led to protests, demonstrations on the streets, and many people clearly felt that the restrictions imposed were pretty draconian. But then they did suddenly lift all the restrictions. And what's your judgment of how many cases there are now in China?
So what China has done is basically flipped from two different extremes that did not reflect or respect the biology of the virus. They went from doing way, way too much to doing nothing at all instead of a targeted public health approach. I do think that you will basically see the entire country get infected. This is an efficiently spreading respiratory virus with more contagious Omicron variant spreading. I suspect that the number of cases is going to be, astronomical, hard to count. This is a virus that's going to infect everyone on this planet, and I think China has so far not had that happen because of the policies they had in place. And now this virus is going to, it's going to exact its toll. They're going to pay their debt to this virus, which is inescapable, and they're going to do it in a manner when they don't have their high-risk population optimally protected. They have shunned Western vaccines. They don't have much Paxlovid. They have poor ICU capacity in many parts of the country. They have a population that does not know how to risk calculate in a world in which COVID-19 is present. So they have created this scenario based on their policies that were put in place for political reasons. And now the Chinese population is really going to have to suffer because of the bad choices their leadership has made.
Yeah, I mean, part of the problem is, as you say, the Chinese vaccines don't seem to be very effective. But the other issue with China, of course, is actually getting to the truth. The official data says that there are 5,000 cases. Some analysts think the caseload is already more than 2 million and could be almost 4 million. And there do seem to be suggestions that some of the hospitals in China are really struggling to cope.
That's definitely the case. We've never seen transparency from the Chinese government when it's come to COVID-19, basically from day zero. So this is not surprising. They have changed definitions of how they define COVID-19 deaths. We know that the cases that they are actually reporting, the deaths they're reporting, are just a mere fraction of what's occurring, just based on what we're hearing from on the ground in the hospitals, as well as even in the funeral parlors and crematoriums, that there are major surges of deaths going on there. So I don't think many people would have any confidence in anything that the Chinese government is saying about COVID-19. They've never been able to be transparent. This is really a lot of obfuscation and political posturing from the Chinese to cover up the mess that they have basically inflicted on their own population.
So given that, is it not sensible for countries like the United States and UK to require this negative test, given that, for example, we don't know what other variants could be circulating in China?
I don't think the test is actually going to provide much, because this could be an antigen test. It can be 48 hours before you go, and it doesn't give us any information on the variant. I think there are, if you want to look at the variants, what we can do are survey the wastewater, for example, on airplanes that are coming from China. Look at the toilet water and see what variants are circulating there. But I don't think that China poses a major risk for new variants, because the population is not very immune, and that's not going to put much of a Darwinian pressure on the virus the way it does in Western countries, where there's so much immunity that the virus is kind of forced to adapt. I just don't think that these cases that are occurring there have the same impact or have the ability to disrupt what's already happened in many of the Western countries, because of the immunity that we have against severe disease. If your population is resilient because of immunity from vaccines, from boosters, from infections and combinations of those, and resilient because you have access to antivirals like Paxlovid, then I don't think that those cases pose much of a threat to you. Yes, the cases may come up or down from there, but I don't think they're going to translate into hospitals in crisis, because the population is heavily fortified against that happening. And the same variants, or we have probably worse variants circulating in the U.S. and Europe and the UK than they do in China, because of the evolutionary pressure. So I just don't think this is that big of an issue for other countries. I think this is a major issue for China.
Just though on that question of other countries, there's been some concern in the UK when it emerged that people arriving from China who do test positive, that there's not going to be any requirement for them to self-isolate, for example, because all of those rules and restrictions have been lifted. Is that the same thing that is happening in the United States?
Well, in the United States, we do have rules that people should self-isolate for a period of time when they test positive, but there's no enforcement of those rules. It's guidance, and that's how it's always been in the United States. Of course, if people are contagious, they should stay home, and I think that should be the requirement in China as well, that they're not out there infecting other people. But I don't think that, this again goes back to what China did. They went from having a horrible policy of welding people into their apartment buildings, of separating children from parents, of forcing people into quarantine camps, of tracking every movement of a person, to now doing nothing. There's a better way to do this, and that's targeted public health, which means isolation of people during their contagious period, and vaccinating the high-risk population with potent vaccines, antiviral access for high-risk individuals, hospital capacity. All of those are important things that they should be doing or should have done for 3 years, but they haven't done anything.
Okay. We'll have to leave it there because we're out of time, but Dr. Amesh Adalja, it's been really good to speak to you. Thanks so much for joining us tonight here on Times Radio.